Have you ever thought about bleaching your teeth? There are a lot of things out there that can help you with that, but there are some things that you need to know before you do it.
Before we start talking about bleaching, it's important to understand the anatomy of our teeth. Our teeth are made of enamel, dentin, and pulp. The enamel is the most superficial part of our teeth. Then we have the dentin. This part is responsible for giving the tooth its color, receiving the forces of your bite, and transmitting a stimuli to the pulp. The pulp is the central part of the tooth, and this is what gives it vitality, as it is full of nerves and blood vessels.
Why do people want to get a bleaching treatment? This can have several reasons. One of them is that we're used to see extremely white teeth on the internet or on television, and this makes us want to have the same. But have you ever wondered why my teeth don't look that white? Well, this is due to genetics, age, dentin color, animal thickness, or external factors such as coffee, red wine, tea, or frequent tobacco use.
A successful bleaching treatment occurs due to the action of multiple chemical substances on our teeth. The best way to do it is with a dentist, because the efficacy of treatment depends on the type of bleaching agent, how acid it is, application protocol, and the type of tooth decoloration, among other factors which can be measured by a professional. The real problem appears when people try to bleach their teeth with over-the-counter products such as toothpaste or rinses.
These products have a negative effect on your teeth surface, making it more permeable, which leads to a general vulnerability to dental sensibility or every other lesion such as caries, fracture, or erosion. So, erosion is teeth destruction by chemical substances like citric acid, acid beverages, or acid from some other sources like hydrogen peroxide or carbamide peroxide, which are the substances used for bleaching.
So, what's the problem with uncontrolled bleaching without professional supervision? As we said, bleaching is an acidic agent that causes erosion, which makes tooth enamel weaker and causes it to lose minerals easier. If we add to this the consumption of coffee, energy drinks, citrus fruits, alcoholic beverages, gastrointestinal disorders, or bulimia, we will experience accelerated wear on our teeth, which will pose a high risk of structural damage and tooth sensitivity.
But how can we identify that our teeth is being affected by erosion? Look at your teeth and look for these signs and symptoms. First of all, tooth destruction with an intact enamel color surrounding the neck of the tooth.
Wear on the tooth, but with intact restoration such as amalgama, incrustations, or resins.
A significant color change. As your enamel is lost, you can see the yellowish dentin.
An increase in your dentin sensibility. Remember we told you that dentin transmits stimuli to your pulp? With an exposed dentin, everything will feel 10 times worse.
If you think that you have erosion, pay attention to your habit. Do you drink too much coffee, red wine, tea, or alcohol? Do you smoke? What about Coke? Or too much lemon?
If you're in doubt, assist with your local dentist and they can answer your question and help you to reach a solution. My name is Jose Luis Torres.
My name is Jose Maria Lavalle, and we hope that you've learned something new from this video.
Woohoo.